the size of the treatment area?
Oh, and don't worry about your thickness, okay? That's another way they're gonna sell Allegretto. They're gonna say if you have a high prescription, like you're what, -6 or something? Yeah.
It's -10.
-10.
Well, if you have -10, our conversation's over because you can't go anywhere else. You can't go anywhere else except here if you're -10. I mean, I'm still happy to answer your questions, but I'm telling you, you can't go anywhere else. No one's gonna touch you, and anyone who touches you is foolish. If they do a LASIK on you, they're gonna get you so thin you're gonna wind up with keratoconus. And if they do a surface ablation, they're gonna do something stupid like a PRK on you, and you're gonna scar. And they're not gonna use mitomycin, and then you're gonna scar. So, you have no choice, okay? But I'm happy to answer all your questions, because you guys are the smartest patients I've ever encountered, and that's why we're filming, you know? Okay, in terms of saving tissue, yes, Allegretto probably takes off less tissue than the Visix, okay? But we don't have to worry about that, because we're not cutting a flap. Do you know how thick the average flap is? Like
130,
130 on a cut. You could do it with a laser, like a eye LASIK or Intralaser, get it to 100. But it's essentially 100 to 130, something like that. How many diopters can we treat with that tissue that we wasted with a flap? Are you clear about the ratio?
Yeah.
So how many microns? Hey, how's it going? You can have a seat here, actually. We're doing like a little mini seminar.
Okay.
That's good for you. Okay, so basically, you know the formula for microns per diopter of treatment?
We have about 12, right? With astigmatism.
Yeah, so in other words, custom's more like 12 to 1, non-custom's more like 8 to 1, okay? The reason we're having this seminar is these guys, I've done like 15,000 patients, so it's quite impressive that they're the most educated and informed non-physicians ever. When my Dr. Corey's one of my fellows, Dr. May's the other fellow, when they saw their questions, they're like, whoa. And they're not stupid questions. We get some patients go on the internet and they come up with a bunch of stupid questions. These are not stupid questions. They're really high-level questions. So I was thinking, why don't we just turn this into a mini seminar? These guys will have their questions answered. Any other free consults will also have their questions answered. And my staff's supposed to be taking notes too. Okay? But basically, we don't have to worry about how much tissue gets taken off because out of the 100 microns that we're saving, we can treat like 10 diopters right there. Your entire prescription is going to be contained within the tissue and you never waste it with a flap. And most of your prescription is going to be contained with that too. So you can see how it's just way, way, way safer in terms of tissue removal. So if you guys ever get the question about like, I went to another center and they said their laser was better because it takes off less tissue, you're going to be like, yeah, what about the other 100 microns of the flap? So you save 10 microns on the laser and you waste 100 on the flap. It's the stupidest thing in the world. But look, I'm just trying to tell you that there are incentives for other centers or other laser companies to kind of cloud the waters because otherwise they got no problem. Okay, so let's go to question number 2. And if you have questions, you should just ask the question. Patrick, have him sit here and then he could fill it out and then he can ask questions too.
Pretty much the second question is about this higher aberration problems, right, that people might get, and relation to the treatment area.
Okay, this has to do with pupil size, essentially, right? It's like a pupil size question, okay? So, I mean, your pupils really aren't that big, right? I mean, they measure you.
They're above 7, though, 7.5.
7 to 5, and what's yours?
About 7.